Very good afternoon to all assembled here. I am Dr. Markandeya Singh. I will be presenting a case of foveal hypoplasia in a 14-year-old patient. Foveal hypoplasia is an ocular abnormality in which the foveal pit does not develop or does not develop completely. It is associated with poor visual acuity, and it may be associated with other conditions such as albinism, optic nerve hypoplasia, aniridia, and nystagmus. Case details: a 14-year-old female patient presented to our IOPD with complaints of severe diminution of vision in the left eye. Since birth, her delivery was normal at 9 months of gestation. All the family members were in good health. Systemic examination showed no abnormalities, and there was no associated nystagmus, aniridia, iris transformation, skin hypopigmentation, or cataract. Upon ocular examination, eyebrow, eyelid, eyeball, palpebral aperture, conjunctiva, and anterior chamber in both the eyes were within normal limit. Cornea in both eyes was clear, and extraocular movements was full in all gazes in both the eyes. Iris was within normal limits. The pupil in both the eyes were round, regular, and reactive to light. Intraocular pressure in the right eye was 16 millimeters of mercury, and that in the left eye was 18 millimeters of mercury. The visual acuity in the right eye was 6/9, while it was finger counting at half meter in the left eye, which did not improve with pinhole. Fundus in the right eye showed normal fundal glow. The media was clear. The foveal reflex was present, and optic disc was within normal limits with a cup disc ratio of 0.3. The peripheral fundus was within normal limits as well. In the left eye, the fundal glow was normal. The media was clear. The foveal reflex was absent, and the optic disc was vertically oval with a cup disc ratio of 0.4. The peripheral fundus was again within normal limits. Investigations: first of all, we did an optical coherence tomography, which in the right eye was within normal limits. However, in the left eye, the foveal pit was conspicuously absent, and there was persistence of the inner retinal layer through the expected area of the fovea. This is the OCT image of the left eye, which shows the absence of the foveal pit in the left eye. Then we did a digital fundus photography in which the right eye showed optic disc within normal limits, the foveal reflex was present, and the peripheral fundus was within normal limits. The left eye, there was a vertically oval optic disc with foveal reflex was absent, and the peripheral fundus was within normal limit. This is the DFP picture showing the foveal reflex present in the right eye, which is absent in the left eye, thus indicating this is a case of foveal aplasia. Treatment: the patient was explained regarding the poor prognosis of vision in the left eye and was prescribed spectacles after refraction and was advised for regular follow-ups. Discussion: foveal aplasia is an ocular abnormality in which the foveal pit does not develop or does not completely develop. Early descriptions of foveal hypoplasia in the early 1900s were in association with other diseases, particularly hereditary nystagmus, while assessing for retinal abnormalities with ophthalmoscopy. A cross-sectional study done by Novel et al. With 286 healthy children found that up to 3% of children had an anatomically underdeveloped foveal pit bilaterally on OCT. Prematurity is a significant risk factor due to associated abnormal developments of retinal vasculature and deficiency of macular pigmentation in these patients. Foveal hypoplasia is also associated with albinism, aniridia, optic nerve hypoplasia, among others. The mechanism behind foveal hypoplasia is still not certain. One theory states that in fetal development, the foveal avascular zone does not develop, and instead astrocytes induce retinal endothelial cell migration across the fovea, which inhibits the foveal pit to form. And Thomas M.G. et al. Developed an OCT-based grading system for foveal hypoplasia based on unique foveal specialization features visible on OCT, which include foveal depth, outer segment lengthening, and outer nuclear widening. Thank you.
So I think that was a good presentation. It is a rare case, and
yes,
it's nice to know these cases. Any comments?